we'd like to welcome you to our radiology lab. I'm Janet Akers, the acting program director for the radiology program.
And I am Love La, full-time faculty for the program.
And this is Wounded Willie. He is our newest full-time faculty member, board approved. So we would like to demonstrate today on Willie how our students can utilize the equipment that we have been furnished and what the board has been able to help provide for us. We are located now in our brand new DR radiology suite. This is going to allow the students to be able to do real-time x-rays and use Willie here to be able to take x-rays without having to x-ray a regular patient. Love's going to talk about a little bit about Willie and his importance.
Okay, Willie is like, for us, he represents a real patient because of the way he's built. So the students are going to be able to take real x-rays on him, and then he has all these wounds, so we can use it in trauma situations too, which is not something that students see a lot in the classroom. So when they get to clinic, they'll be comfortable because they have a chance to practice taking x-rays on someone that looks like Willie in the hospital. So by them having Willie in here and having new machines where they can actually take x-rays and look at the x-rays and we can tell them if they're good or bad, it is a very good thing for our students, and this is something that a lot of students in other programs don't have.
All right, we're going to take an x-ray on Willie just like the students would. So we're going to take our digital flash pad, which is some of the newest technology that's out there. We're going to place this behind Willie. Position him where we need him. Okay. We're going to make sure our x-ray tube is where that needs to be. Also going to put some lead over Willie, practice some safe radiation protection here. We got our marker on here. All right, and we are ready to go. Okay, we have Willie all set up. We're ready to take the x-ray. Willie, I want you to hold your breath. You can breathe, and you can see as soon as we take that x-ray, it pops up on the computer screen for us to be able to look at. It takes a minute for it to process to get the regular image. And now with this new technology, we can change our image however we want. We can annotate it to where the patient is upright. We can take our markers off. We placed one on there ourselves. And then because Willie is wounded, he has some shrapnel and bullets in his chest and abdomen that the students are going to be able to look at and recognize that those are not what is supposed to be in a normal patient. So they will get simulation not only with the outside of Willie with seeing wounds and having a patient that is not able to move, but they'll also be able to see the pathology that sits inside of Willie and know that that's not quite normal. And once they have taken the x-ray, they'll be able to process that just like they would in a regular patient situation in a hospital or clinic. So we'd like to thank you again for taking the time to view our lab and see how our patient simulation and radiology suite works and how our students are going to benefit from this new technology.